Scotland's Singing for Health podcast, produced by the Scotland Singing for Health Network. I am Brianna Robertson-Kirkland, and today I am joined by two very special guests. Before I introduce them, let me tell you a little bit about this podcast series and why we're talking about Singing for Health. Singing for Health groups support the management of a range of conditions such as respiratory conditions, dementia, Parkinson's disease, and mental health concerns. In each episode of the podcast, we'll be talking to singers, singing group leaders, researchers, and medical practitioners to find out more about the benefits of singing and what singing for health activities are taking place all around Scotland. Today, our podcast focuses on singing as part of cancer care, and we are joined by Carole Miller, who runs Hebridean Harmony, a singing group for people affected by cancer on the Isle of Lewis. We're also joined by Katey Warran, who is the Deputy Director of the WHO Collaborating Centre for Arts and Health in the Department of Behavioural Science and Health at University College London, and who has undertaken research on the impacts of singing for people affected by cancer. Thank you both for joining me today. So cancer is something that may well have directly or indirectly affected our listeners in some way, either through a diagnosis they may have received or through a friend or a family member experiencing illness. We know that there are lots of support charities out there to help people who have been affected by cancer, but perhaps singing as cancer care and support is a little less well known. I'm just going to throw this out into the room. Could both of you tell me a little bit about singing groups that are designed to support people with a cancer diagnosis or support people who have a family member with cancer? Have they been around for a long time?
I'm happy to kick things off. I'd say that there's a range of different kinds of singing initiatives available for those affected by cancer that have existed for like the past few decades. So this includes community choirs, or it could be singing workshops or songwriting therapy sessions. There's also more formal sessions run by music therapists in community and clinical settings. But over the past 10 years or so, there's been a surge of interest in creating more bespoke choirs for people affected by cancer in the community. And much of the research that I've done has been on singing and cancer with the charity Tenevis Cancer Care. And they run a range of choirs for those affected by cancer called Sing With Us choirs. And we did some research with them when I was based at the Centre for Performance Science, which is a joint centre that sits between the Royal College of Music and Imperial College London. And they have a whole range of choirs, around 16 choirs in the UK, I think it is. But there are also many other local choirs connected to different charities and different community centres and different clinical centres. One example are the Maggie Centre choirs, and they're kind of drop-in choirs which are connected to the Maggie centres, which are based all around the UK. So if there are any listeners out there looking for local choirs, I'd say that's a really good starting point as well.
Excellent. Thank you so much, Katey. And I know that there is a Maggie Centre that is based in Glasgow, and they do have a singing group because I know that my cousins were part of the singing group that was there a few years ago. So that's a really good tip for anybody who might be in search. Thank you so much. Hey, Carole, but what about yourself? Like, we know that you run a group on the Isle of Lewis.
Well, we were inspired by Tenevis because one of our initial founder members came from Wales and had experienced the Tenevis choirs before and wanted to help set up something like that on Lewis. But of course, I'm not a trained music therapist, but I have done music psychology, so I thought at the very least it would be a distraction therapy as much as anything. We don't audition anybody, and we're supported by the Western Isles Cancer Care Initiative, which is based on the Maggie Centre model, but our nearest Maggie Centre is Inverness. So the Macmillan help fund Wiki, and so thereby they were all involved in the setup of it, and we all decided that it can't do any harm, that would be, although we didn't have any we had plenty of information about the science that would help, but we hadn't experienced it ourselves. So we thought at the very least, though, we couldn't do any harm. So it would be a way of bringing people together, because in the Western Isles, and that's the thing, although we're based in Stornoway, we're open to everybody within the Western Isles. And the good thing about being the pandemic, one of the good things that have come out of it, is that people in Barra and Uist and Benbecula have been able to access the choir. So when we go back to face, we're going to do blended, so that the people that from far away, and also if people are undergoing treatment and don't want to come out and risk getting a cold or whatever, then it's been a good reminder that we can do that sort of thing. Whereas previously I might not have thought about it. There's enough to think about, isn't there, without having to rejig everything. But yes, I think with the tablet it'll be pretty easy to set up, that they can join in and sing along if they want.
Excellent. That sounds wonderful, Carole. Can you give us a little bit of insight into what it was like pre-pandemic, so when you were meeting in person?
Well, we only started in August 2019, so there wasn't that much pre-pandemic, but it was growing. What we found was, because we don't audition, we don't. It's not a choir as such. I had a lot of difficulty getting my head around that to start off with. That we weren't aiming for performances, so I had to find different kinds of ways to motivate myself, let alone the others singing. But it was growing and growing because we've got a reputation for laughing a lot and saying totally inappropriate things, but everybody takes it in the spirit that it's meant, and so, like, we're right next door to a dentist, but they were doing work on a building on the other side, and you could hear the drill, and one of our members had left early to go to the dentist, and we could hear this drill from, and we're saying, gosh, I hope that's not the dentist, that kind of thing. We just laugh, and what's really good is in the Western Isles, it's staunch Free Presbyterian mostly. So without going into too much detail, it means people are quite hesitant to share and come forward for things, because that it's just the way they are. And what we found with the choir, as news has got out that everything's confidential and that you just come, you sing, you laugh, and you go away again, that it grew and grew and grew. And so we were seeing 20 to 30 people in start a week, and trying to think about, oh, we're going to have to go somewhere else because the wiki room was too small, and is definitely too small to meet in pandemic terms as far as distancing and things is concerned. So that's our next challenge, is to find somewhere that's suitable. But online, it's come and gone, because you know what it's like. Some people just don't like the Zoom. I've worked really hard to make it as engaging as possible, and for me to be as excited as possible online with them, that so much so that I have to go and lie in a darkened room for an hour afterwards, because it's so you have to be. You guys know what I'm talking about, and I'm sure the listeners do too, that you just have to be over exuberant to so we've probably had 10 to 15 people online, but we're going to be singing face to face on the 20th in Stornoway, outside in the big square, singing lots of Christmas carols, and we've invited quite a few different groups. Like we're involved with Catch 23, which is our Western Isles mental health charity. So because of my involvement with the mental health network, they're going to be coming along and singing, and like, hopefully, because what we've realized is that cancer affects pretty much everyone, so to have this label of a cancer choir is quite useful in some ways, but actually everyone's going to benefit. Everyone should be able to benefit from coming along and singing, and not being in the sort of formal choral union type choir, which is also beneficial, but isn't necessarily what people want, especially if they've not experienced those kinds of genre of music before. They just want to be able to influence what they sing, and so what we do is once a month we decide what a theme. Well, I decide what the theme is going to be, and then they make suggestions about songs. So, for example, we did a month of Mondays, so there was like loads of songs about Mondays, and so they're mostly pop and country type songs. But we have done Ave Maria and things like that as well. So we try to do a 2-part for the whole month. And on Zoom, it's not these guys have never sung in parts before anyway, but so that's a good thing about getting these people singing, that they've not been in choirs, they've not experienced it before, and to see their faces at the end, even on Zoom, where they don't actually want to leave because they're having such a good time, that it's good for me. I don't know how many Mondays I've thought, oh, do I have to, and then when it's been on Zoom, it's different when it's in person, but and then I felt invigorated at the end of it, despite having to lie down in the room afterwards. But they give as much back as they get, and that's the thing, isn't it? The more you give, the more you get. So yeah, I think it's very beneficial, but it's all anecdotal. I've not got any science to back me up.
No, well, that's amazing, Carole, just to hear the group that you're running on the Isle of Lewis, and then the initiatives that it's also tying into as part of that. Katey, I wonder if you could tell us a little bit more about what singing in a group such as Carole's or other groups that are around the country can do to support someone who has a cancer diagnosis or a family member who knows someone who has a cancer diagnosis.
Well, I think these kinds of singing groups are really good to be able to meet the psychosocial health challenges of having cancer. So we know that people who have had cancer are approximately 5 times more likely to have depression than someone who hasn't had cancer, or the general population. We also know that other people are affected by cancer, such as family members, caregivers, hospital staff. Carers are predominantly family members or friends who also experience substantial amounts of logistical or emotional challenges, and they're affected by anxiety and depression themselves. And also working as a staff member in a hospital is also stressful and challenging, and many also have to cope with grief or the loss of patients too. So these kinds of choirs can really help to provide support for quality of life and mental well-being for those who are experiencing these kinds of psychosocial challenges. So whilst we know there's this clear challenge around providing effective treatments for those affected by cancer, there's this additional challenge around providing holistic healthcare, and choirs are just a fantastic way to be able to do that, as we've heard from Carole as well. So we know that singing in choirs can involve many different components as well that we know to be beneficial for health and well-being. In our research at UCL, we've been exploring this as part of our research, looking at the active ingredients of arts and culture. So these are the kinds of things that are in arts and health which may be able to support our well-being. And when it comes to choir singing, it could be things around the social aspect. So it's making friends in the choir, those little moments before singing together, having a cup of tea. It could be the musical components, so singing something positive like Carole's mentioned, or in the 10 of us choirs we used to sing things like I Will Survive or Make You Feel My Love, well-known popular fun songs. And these things really help to support and lift social and mental well-being. And often the music itself may connect to memories or be particularly meaningful for individuals and help with catharsis or connecting with emotions, which can also be really supportive of mental health. And there's also the physical aspect. So there's breathing exercises at the beginning, or maybe physical exercises, which can help us to connect with our bodies and may even support physical health in the long run. Some of the participants that I engaged with the 10 of us choirs also said that it helped to provide in their wider lives with behavioural change, for example, building confidence through engaging with the choir, meaning that somebody was able to give a presentation at work or able to join the gym as a consequence. So there really are knock-on effects that have real tangible and scientific benefits that can support mental health and well-being in our wider lives.
Excellent. Thank you so much for that, Katey. So you're talking quite a lot about the research that you carried out, which is amazing. Could you tell us a little bit about what the study looked like that you've carried out?
Yeah, sure. So the 10 of us study, which I've been saying a little bit about, was a 2-year study that was based at the Centre for Performance Science at the Royal College of Music. So it was a mixed methods research project, and we collected both quantitative and qualitative data. So the quantitative part, we'd collected a very small saliva sample before and after singing. We did that in a small 1-hour session, actually it was 70 minutes, and we also collected saliva samples at baseline and at several periods throughout longer term participation in the choir as well. And that was so that we could analyse stress hormones in the body to see whether there was any reduction in physiological stress across singing. So this is looking at cortisol levels. We also collected different surveys, so we were looking at questions around mental health and well-being, in addition to carrying out interviews and focus groups to analyse the experiences of choir singing for those who are engaging with it. So that was looking at those more emotional, holistic elements as well, the subjective experiences of engaging. And all of those papers are now out and published, so do take a look online if you'd like to read more about it too.
Excellent. Thank you so much, Katey. That's really fascinating, and we'll link some information about your study in the show notes below. So I'm just going to come back to you, Carole. Can you tell us a little bit more about how you got involved with setting up your group?
Well, I was just approached as a possible person that might be interested. I think I was the first person they'd approached, and they didn't have to approach anybody else because I was immediately interested. I did my master's in Sheffield in 2000, way back. And in the middle of my studies, I did it part time over 2 years. I ended up having a complete pelvic clearance because of ovarian cancer, but it was discovered really early, so I'm still here 20 years later, so I'm really happy about it. And so my dissertation was looking at using music as an adjunct therapy for pain control. So that kind of music therapy, or using music as therapy as opposed to music therapy, I'd always been quite curious about it. So immediately, because this lady told me all about tenevas, I was straight on Dr. Google and having a look at the research, and totally blown away. But because I'd always felt that singing was really good for you and that everybody should do it, but didn't realize that there were actually physical benefits. Not I mean, it's logical when you think you're taking deep breaths and you're controlling your breathing, so it's almost like mindfulness in some ways that's become such a big thing recently as well. And so I was just asked, and we thought, well, where do we go now? It was the Macmillan coordinator for Lewis that had been in touch with me. She's an Olympic athlete, a retired Olympic runner, also from Wales, funnily enough, but been on the Western. So we have nothing in common, but we've made a great friendship. And we thought, what do we do now? And Wiki, the Western Isles Cancer Care Initiative, had just sort of started up, found a venue to be in as opposed to a room somewhere. And so we went to them and we said, what about this? And at the same time, we'd gone to a couple of the mental health charities on the island and said as well, I think that you should be involved in this. And we can't tell you why we think it'll help, but it can't do any harm. So it's not like plugging you full of drugs and hoping it might work. It's not going to do any harm for anybody. So that's basically where we started out. We had a couple of taster sessions because I think the lady that runs the Wiki Centre wasn't absolutely convinced that there was a need, because we have lots of Gaelic choirs on the island, but they're competition choirs that all they do is practice to go off to the modern national competition every year. And so they don't tend to go out and about in the community. And although it's fairly still a strong Gaelic speaking community, not as many people are interested in being part of the Gaelic choirs. There is a choral union type choir in Stornoway as well, but that isn't what most people don't want to go and sing Bach, and I do. I sing with them. But so that's how we all started. And what's been good for me, I think, is that I have the support of the director of Wiki, and I have the safeguarding training that I was given by Macmillan, and also Macmillan. So if I have any problems or don't know how to deal with something, then they're always there to ask, and they have access to all sorts of counsellors. And so if I notice that somebody's been affected by a song that we've sung, I mean, we sing all sorts as well. We sing our anthem, if you like, that we do every year is "Carry Me Home" by Ward Thomas, because we feel that's a really, we'll be there to carry you home. The words are quite relevant to what our message really. And that, so we've created a family, if you like, a family atmosphere where people can feel that they can go and talk to somebody, because that's the other thing in the Western Isles, because of their upbringing, they don't want to go to talk to counsellors. When Wiki first set up and they had these counsellors and Reiki, oh my goodness, what would that be? They would think that it was some sort of magic voodoo sort of thing, and not realizing how much these kind of therapies can. And we have a massage therapist who's qualified in oncology and doing massage for people with cancer. So but people were a bit slow in coming forward to access these things. So what we found is the singing group has almost been like a promoting vehicle for the rest of what the centre does, and it's just grown from there. So yeah, they just approached me and asked me. They might regret it now, I don't know.
No, that's wonderful, Carole, and for giving us such insight into how it's become a real community in trying to support people with cancer in a variety of ways, in addition to singing, which sounds like a really fabulous project. Katey, I wonder, are there similar kinds of things happening around the country? Do you know of anything else kind of like this?
Well, as I mentioned earlier, there's the Maggie's choirs, so they take place all over the country and actually internationally as well. And the 10 of us choirs are all based in Wales, so there's 16 choirs in Wales. 10 of us did have 2 choirs in London as well, which was the Fulham and Sutton choirs, which are part of our research. But I think they've had to go online because of the pandemic situation at the moment. But there are lots of other local community choirs which you can connect to via hospitals. For example, in East London, they've got one like that. There's also quite a lot in Ireland as well. I think there's a programme called Something to Sing About or something along those lines. So if you're based in Ireland, there's some things there. But I'd really encourage people to go along to their local healthcare organisations to see if there's any social prescribing or arts on prescription models where they may be able to be referred to places into the community or local community centres as well to ask about what might be in their local community.
Thanks for that advice, Katey. And obviously through the Scotland Singing for Health network, we are mapping the singing groups that are supporting Singing for Health all around Scotland. I'll tell you a little bit more about that later in this podcast episode. And if you've been tuning in to most of these episodes, then you've probably heard me talk about this all before. But I'll pass back on to Carole. Can you tell us a little bit about what a typical singing session for your group would look like?
Well, even before we were online, I think because I'm not a trained singer per se, I think it's really important to do it safely. And so I've taken lots of lessons from people who know and use lots of breathing exercises because we all don't breathe properly. And so we've used lots of breathing exercises. So typically we do a few minutes on breathing and then we start to use the voice with different vowel sounds. And then we do some flexibility exercises. But also I've been using some methods that have been advocated by various singing professionals to distract from the tension, because you know what it's like. You get really nervous, especially if you're singing with other people, and the tension comes into your voice. So we've been doing things like leaning forward on roller coasters when we're going high, and eventually I keep saying to them, you don't have a TV on your head that tells everyone what you're thinking about, so eventually you don't have to do the lean forward on the roller coaster. You just think about it until you actually do it naturally. And so we do lots of things. Waving our arms like eagles. We have a lot of different kinds of eagles. We have golden eagles and white-tailed eagles, sea eagles, on the island that are seen quite frequently. So frequently we get quite blasé about it. We just like, oh, there's a big bird. And so yeah, flapping like eagles, anything to distract from them. And then we sing through a couple of songs that are related to the theme. So it's Christmas just now, so we've just been doing Christmas. Last month was places, so we were doing things like Chattanooga Choo Choo because it was going to a place, and Budapest, which interesting for me is I've been analysing them and telling them a little bit about structure as well, and teaching them a little bit about counting and time signatures and key signatures. I was like, you don't have to know this, but especially as a singer, because you can sing in any key without actually realising. But here you go, this is the structure. And some of the structures are so simple that actually saying to them, well, we do this, and then it does the same with different words, and it does the same again with different words, but it's just the same all the way through, makes it seem much more accessible to them. And then we work a little bit on what we call our inspirational songs. So whatever we're doing for the month. So when we did places, it was 2-part version of Africa. And but they just love, like when we did The Way to Amarillo for the places, it just so happened that I had been playing at a wedding the week before with a DJ from Glasgow. It's very, very odd that people come to it was somebody from England came to the Isle of Lewis to get married in our castle and brought a DJ from Glasgow. That I would have thought traditional music, but there I was on my saxophone. Anyway, so we did the Way to Amarillo, and he taught them how to do the slosh, because of course, I don't know if Katey's heard of the slosh before. It's basically line dancing, basically. So I said that their exercise for the week had to be to practice the slosh, and so they loved it. They were up doing it on Zoom, showing me what they had done and everything. And some of these people are like in their 80s, and so it's been good exercise as well. So yeah, that's what there is no real typical, but the format is much the same. We sing along with backing tracks. We have two parts that we try to do, and we note bash through them for a couple of weeks and then try to keep singing them through with the backing track. So that's the basic bones of it all, but no 2 weeks are the same really, as far as yeah, that's how it is.
Excellent. And you've already mentioned a couple of notable songs, but do the group have a particular favourite song?
I think they do, like the "Carry Me Home" by Ward Thomas, because it means a lot to them, and we explained to them at the start that it was kind of one of these serendipitous moments that it was being played on Radio 2 by Ken Bruce or somebody like that, and to be quite honest, I hadn't heard of Ward Thomas before then, and it just so happened the director of the Western Isles Cancer Care Initiative had heard it as well, and she was like, "I think this should become our song. It just says everything about what we want to be. We want to, be there to carry you when you can't, and when you can't go on, when it say the words are quite, I think the listeners should go and look it up and look up the words, and they're a great duo actually, just to listen to, full stop. But that particularly, and it's in two parts, and so right away I was thinking they'll never manage two parts because these guys have never sung with people before, but no, they were totally up for it. So I keep saying to them they should be at least willing to try. If I say to them that the best way to sing is standing on your head with a flower under your arm or something, you should be at least willing to try. Even though common sense tells you that's not a good thing to do, you should be at least willing to try. And they are. They've become totally up for anything. And because that's set the culture of it, then new people coming in, that they just get into it as well. So it's good. Yeah, doing the slosh online. Can you imagine? I hope the listeners have got a great picture in their head.
Well, then maybe this is an opportunity for listeners, if you want to put on the slosh and start line dancing to the podcast, then by all means. And then maybe tell us on Twitter, if you're on Twitter. Passing back over to Katey. So you've told us a little bit about the research that you've been carried out, which is absolutely fascinating. What's the next steps? Do you have other research plans in the works?
Yeah, well, I think a lot of the findings from the 10 of us study were really exciting. So we found that 70 minutes of choir singing could reduce stress hormones in the body, so reduce cortisol in the body, signs that people were becoming physiologically more relaxed from singing. Our survey data showed that choir singing significantly decreased anxiety and significantly increased well-being for carers of patients with cancer. And we also found that adults bereaved in the last 5 years had more stable symptoms of depression and levels of well-being from singing in the choir for just 12 weeks. Those are really exciting findings. Our qualitative results also found that men living with prostate cancer who sang in the choir for more than 12 weeks experienced group singing as being really positive and a social experience. And it helped with coping with things like existential uncertainty. So a lot of what Carole's been describing is kind of having fun and being in the moment. It's just so vital at this time where people are going through quite serious things in their own personal lives and potentially bereaved as well. So just incredibly important. And it also showed that the choir helped to build resilience for those affected by cancer. So I think thinking about like the next steps, we all need to think about how we can provide access to these incredibly important and valuable interventions that can be quite cheaply delivered really in comparison to a lot of other clinical interventions. So we need to ensure that they're free or affordable and that we're providing culturally diverse forms of singing nationally. So singing all kinds of different music, inviting people from all different kinds of cultural backgrounds. And this is a clear challenge at this time to try and make sure that these are accessible, and particularly in view of the COVID-19 pandemic as well. And there's lots of hidden inequalities and structural inequalities which I think we need to explore in future research to make sure that these interventions are readily available for anyone who wishes to make use of them. So I think it does actually sort of connect to a broader social issue. So at UCL at the moment, we're carrying out some research as part of our COVID-19 social study. This is a panel study of over 70,000 participants. And what that's highlighted is that during COVID-19, there are certain groups that have been more adversely affected than others, and this has included those with long-term conditions, and that includes those who are affected by cancer. So we know that this group has been more adversely affected from a mental health perspective, and that it makes so much sense to offer these kinds of things in communities where there may be not so long waiting lists as there may be to go to provide sort of counselling or other kinds of psychological support, which is incredibly important, of course, but this is another way of getting support from within our communities that may be able to provide support psychologically, socially, behaviourally, psychologically and physiologically. So I really think we need to kind of embed these interventions in clinical pathways and to carry out more research so that we can make it accessible on our healthcare system and in our communities to anyone who wishes to benefit from them.
A really excellent message. And I wonder, what could we do? What could we do as a network, as singing leaders, as singers? What could we do to make sure that these are embedded in our communities so that people do have access to them?
I think a lot of it comes down to partnerships. One of the reasons that Tenebus research was so successful in London was that we had a partnership with the Royal Marsden Hospital, and we actually had a relationship with different clinicians, and they were able to directly tell people when they were receiving treatment that this was something that was readily available in the community that you could go to. And it's not just a formal thing. It's not just like sitting down with a GP or a link worker and being directed formally to services. It's having posters in hospitals. It's so that nurses are on the floor of the hospitals are aware that this is something available, and having informal conversations with people. And then partnerships also with charities like Tenebus Cancer Care, like the charity that Carole's working with, and then with singing organisations, with conservatoires, with cultural institutions. I think if we can really bridge all of those groups together, we can together make sure that there's an awareness that these kinds of things are out there. I know there are so many people who would love to take part in something like this, but they just don't know how to find it. So if we can have networks like the network, Singing for Health network in Scotland, that can hopefully strengthen these partnerships. But I think another thing that we can do is to have our own kind of reflexivity and our own awareness of when we're delivering these kinds of interventions, of what it might be that might actually put somebody off. Because sometimes when I've approached people to say, would you like to come and join our choir? They tell me a story about how they were sent to the back at school and how they don't sing and that they don't like this kind of music. And actually having something to say, well, you know, this is really open and inclusive. And what would you like to sing? Like asking people what they want rather than trying to dictate what can be sung, because we all have that kind of song in our head that we don't like, or a song that maybe makes us feel a bit uncomfortable because we heard it when we were younger and it attaches to an event that we don't want to be reminded of. So I think it's being aware that actually music is so sensitive. Like sometimes we think to ourselves, oh, music is non-invasive, so it can't have any kind of adverse consequence. But actually it's incredibly emotional and sensitive, and it does have these enormous well-being benefits when it works. But it's different for everybody, and it's a subjective and emotionally laden experience. So I think being aware of that, being aware of cultural diversity and including a range of different types of music that can reach out to different people, and working with those affected by cancer and not dictating what it is that we want them to sing, and being collaborative and working together in co-producing this kind of work.
Oh, thank you so much for that insight, Katey. And that obviously speaks to your experience, Carole, and what you're doing with your group, doesn't it?
Absolutely. I mean, we don't often have the cultural diversity here because we're stuck out in the middle of the ocean, in the middle of nowhere. But it is still being aware. Strangely enough, having said that, though, most of the people are what would be considered incomers, that they might have been here a good few years, but they're English or from lower Scotland, and so they've come to the island, and they seem more able to feel that they can access these things. It's getting to the groups that that aren't, they're reluctant to talk about things. But the good thing about any singing group actually is that although it's a cancer choir that we run, it's not necessarily your reason for being there. You don't have to talk about cancer. You don't, you're there to sing. And hopefully by getting out and about as well and singing at various, just before lockdown, we sang at a session in town, and lots of people were coming up and asking about it afterwards. So hopefully we can be our own best advocates in the island to say, look, that we just have a lot of fun, and but the other services are there if you want to access them. You just have to ask, or sometimes they don't have to ask. Sometimes I can see somebody's upset, so I'll make sure that I follow that up afterwards and say, look, I think you need to talk to so and so about the possibility of XYZ, and hopefully then. But yeah, I think we have to be our own advocates, but a network would be just amazing of health. Well, we have the network of health choirs, but being out there and being seen, because it's just seen as such a fuddy-duddy thing, choirs and things, I think, for some reason. I mean, it hasn't been like that really for years, but it's just people's preconceptions, isn't it, that we have to deal with.
Yeah, definitely. Breaking down, as Katey was talking about, potentially negative experiences that someone might have had as a child, maybe in their school choir, or maybe thinking that they can't sing. We've heard that in quite a few episodes of people saying, oh, I can't sing, so I can't join a singing group. But these groups are obviously designed to be more than just singing. It's about having fun, the social connection, being in the moment, being present, and there are real benefits, regardless of whether you think you have a good voice or not. Is that a fair assessment?
Absolutely. I mean, I've been lucky that we have people who can sing, but they didn't know they could sing when they first came. But I mean, what there's only something like 0.03% of the population are actually biologically tone deaf, something like that. So it's a muscle. And I keep saying, I can't run a mile because I don't. So you're not able to sing because these days we don't do a lot of singing. Like we used to 50 years ago. So it's a muscle, and you just have to knock off all the get it exercise and start using it, and you'll be amazed at what comes out. And it has been amazing. We did a wee project just before the summer, where we all recorded Here Comes the Sun. Our two-parter for June was Here Comes the Sun, and we recorded it and we put it together in a film. And actually some of them aren't very tech savvy, and all they had to do was press film on their phones, but I had to go to some people's houses and do it for them. And I was amazed because I hadn't actually personally heard them sing. And I was just amazed actually that everybody has developed a voice. I mean, there's some you can hear that it's still rough, but you know that there's something there, and they can hold a tune. So I've been lucky that way, but I wouldn't turn, if we got a droner, I still wouldn't turn them away, because if they're getting something from it, then that's absolutely okay with me.
Excellent. Thank you so much. So my final question for you both is, there might be someone who's listening here who thinks that they want to start their own group or choir to help those who have a cancer diagnosis or who have family members with a cancer diagnosis. I wonder, is there training available for someone who might like to do that? Are you aware of any schemes?
At UCL, we've recently been designated the WHO Collaborating Centre for Arts and Health, which I think you mentioned at the start. And on our new website, there's a list of training opportunities on the development page. So it's broader than just singing, but if you're interested in getting involved in arts and health research or just learning more about some training that's available. And we actually have a course running next year called the Arts and Health Research Intensive, which is a training program for early career researchers led in partnership with the University of Florida. And it takes place in May of next year, and it's in the beautiful surroundings of Snape Maltings in Suffolk. So that's a rich introduction to the evidence base around the arts and health. But we do also talk about practice. We do also talk about working with practitioners, what it's like to lead these kinds of arts and health interventions and embedding them in clinical pathways, and all of the kind of things that we've been talking about today. And we also recently launched a course in partnership with the Royal Society for Public Health, which is an online course, so you don't have to go anywhere, you can do it from home. And that's another way to learn all about these kinds of interventions. That's for community organisations, community practitioners, early career researchers, anyone interested in understanding how community resources or social and cultural community choirs like this, singing interventions, can improve our physical and mental health and well-being. So I think those are a couple of really good tips. Another place I would look is the Culture, Health and Wellbeing Alliance, which lists loads of resources on the website, as well as Arts, Culture, Health and Wellbeing Scotland, ACHOOSE, which is a network based in Scotland, where we aim to link together lots of different community organisations and choir organisations, including choir organisations. So that's another good place to get in touch with. I think, as we mentioned earlier, networks are a really good starting point for how to get involved. And do sign up to our Collaborating Centre mailing list as well, where we often list training opportunities on there too.
Excellent. Thank you so much for all those tips, Katey. We'll link those in the show notes. Carole?
No, I was just going to say that I would say if anyone's thinking about it, just do it. Just do it. And if you're thinking about going, then just go. Just find any choir, even just to go and sing. I mean, there are health choirs around that are specific. So, if you want to aim to help a specific condition, then you can look for that. But singing full stop. I mean, the reason 10 of us is called 10 of us is because there was 10 of them that just got together to sing to start off with. So even just singing with pals, have a wee ceilidh at home, and with a wee cup of tea and a cake, and where normally singers wouldn't want cake, but it's all part of it. So yeah, the community side of things. So yeah, just jump in, and you won't know if you'll like it or not until you give it a go. But if you're thinking of starting one, just do it.
Excellent advice. Thank you so much, Carole and Katey. Now, I know Katey just mentioned getting involved with networks, and obviously we are a network. We're the Scotland Singing for Health Network. And what we are aiming to do is to just give some more visibility to health groups. So through our project, as I said a little bit earlier in this podcast, we are designing an interactive online map where people will be able to see if there are any singing for health groups in their area, and will be able to find out when the group typically meets. Now, that map won't be ready until 2022. But in the meantime, we have heard some of the advice from Katey and from Carole of groups that are available in the Western Isles, so the Isle of Lewis, and available training that we're going to link in the show notes below. Just before we end our discussion, I wonder if there's anything that we haven't discussed today that you would like to add now.
I think I'd just say give it a try, really, building on what Carole said. If this is something that you're thinking about might be for you, it's really just a case of kind of getting over that initial hurdle and just giving it a go. And you don't necessarily have to kind of go alone as well. Like, that's another thing I often recommend to people. If you're thinking about going to a choir for the first time, you can bring a friend with you. You can take a family member and give it a try. And you know what? If you go along and it's not for you, it'll be something fun, and you can talk about it afterwards, and who knows, you might end up coming back the next week and having another fun experience. So I think I'd just say, even if you're unsure, why not give it a try?
Absolutely. We've had carers come along with gentlemen in particular don't seem to enjoy it quite as much, and so we've had carers come along, and then the gentlemen have not wanted to come back, which is fair enough, and the carers have asked if they can still come. So we just said yes, of course, because they're affected by cancer just as much. So yeah, just take a friend. Take two friends.
Excellent. Thank you so much. Thanks to Carole and to Katey for joining me today. It's been a really wonderful discussion. There's been lots of top tips, lots of advice, and it's lovely hearing about the research and the work that is going on in the Isle of Lewis. So thank you so much to you both. Thank you all for joining us today. We have now come to the end of the first season of Scotland's Singing for Health podcast series. I would like to take this opportunity to give a very warm and heartfelt thank you to all of our contributors and our listeners. I would also like to say a very special thank you to Sophie Boyd, who has been doing all of the technical setup and has edited this series together. Thank you so much to everyone who has been involved in producing this series. Never fear though, we will be returning for season 2 later this year. If you have any suggestions for what episodes you would like included in season 2, please get in touch with us via our email. Our contact details are in the show notes.
When the and the night is as still as you're sleeping. I'll block out the stealth of the moon from the sky, and I'll give it to you for sticking. Wherever we go, wherever we ride, whatever the wind and weather. Wherever we go, wherever we ride, we'll travel these ways together. Wherever we go, wherever we ride, whatever the wind and weather. Wherever we go, wherever we ride, we'll travel these ways together.
This podcast is produced by Scotland's Singing for Health Network, a project hosted at the Royal Conservatoire of Scotland, funded by the Royal Society of Edinburgh, and in partnership with the University of Edinburgh. For more information on our activities, please visit our website. Details are in the show notes.